the Far East, and of course we have participation from the Middle East, also Middle Eastern countries, from Bangladesh and Sri Lanka. All the delegates, a very warm welcome to you on this another online training program, part of the series being organized jointly by NIDM and FICCI. I must also thank General Bindal, Major M.K. Bindal, who would join us shortly, the Executive Director of National Institute of Disaster Management, Ministry of Home Affairs, for his constant support and his able leadership that we continue to hold more of these training programs, in collaboration with FICCI's CIDM board, which is the Chemical and Industrial Disaster Management Board, chaired by none other than Lieutenant Dr. J.R. Bhardwaj, former founding member of NDMA. And of course, many thanks to the team at NIDM who help us put this together. And of course, I must also acknowledge the support of the entire FICCI team. Akhil is here, Mainak, Varun, who really come together. We work overnight, and apologies if there was any inconvenience last week, because we had to postpone this event by a few days due to some, the unforeseen circumstances. There were certain, tragedies which just shook us from inside at FICCI, and we lost a couple of our colleagues. So, but then they've given us, I'm sure they would have wanted the show to continue and go on. And, our very dear colleague Amit Tyagi and Amit Prasad, both of these colleagues, they left us fighting post-COVID complications. But I'm sure as FICCI, we all stand behind them with their families in this time of need. So that was a short reason why we had to push it by a few days. But here we are. In last 1 year, we've done series of these online training programs, and the numbers of registration has only gone up. So it is safe to assume that it is becoming a popular platform where people see value and see some sort of learning which comes out of these initiatives. And I'm really glad that we have over 700 registrations. We are live here on WebEx and also on our YouTube channel, where people access the online training program parallelly, or even they can refer to those, because they will always be there in FICCI YouTube channel, which they can refer to even at a later date. So I think Professor Ghosh, if you agree, we could have the lead lecture, because, ladies and gentlemen, we have a tight schedule. We have some very eminent speakers. We will start with Dr. Chandan Ghosh, who's the professor and head of Resilience Infrastructure Division at NIDM. Then we have our very own Mr. Rituraj Mehta, corporate head, safety and business excellence at Adani Power Limited, Adani Transmission and Adani Infrastructure. Also the co-chair of FICCI's Disaster Management Committee. We would welcome him as well. We have Mr. Dr. Ghosh, who would be, making a detailed presentation. As I earlier said, the lead lecture would be presented first, and then followed by, a brief inauguration session where we'll have hopefully Major M.K. Bindal and Dr. Ahmed join us for their special comments and their keynote address. So on that note, I would like to introduce, ladies and gentlemen, man who needs no introduction, but who's been the force behind this entire online training program, the man, the brain behind this, Dr. Chandan Ghosh himself. Dr. Ghosh currently works at the Ministry of Home Affairs, National Institute of Disaster Management, as a professor and head of Resilient Infrastructure Division since July 2006. Professor Ghosh does research, training, capacity building for engineers, architects, and planners in disaster resilient construction, geosynthetics applications, disaster mitigation and management, retrofitting, rapid visual screening, disaster documentation, bioengineering solutions by vetiver grass, etc. He did his first PhD from IIT Kanpur in 1992 and second from Ibaraki University in Japan in 2004. His current project is revising DM plans for CPWD establishments. So on that note, it's my privilege to invite Professor Chandan Ghosh to make his presentation, his lead lecture, and we are very excited to hear you, Dr. Ghosh, and your thoughts on this very subject, which is very pertinent, as I initially said, role of industries in COVID-19 mitigation and management. Over to you, Dr. Ghosh.
Okay, I think I have some problem.
Is there a problem with sharing the screen, sir? I think Dr. Ghosh is trying to connect and share his screen with us. Meanwhile, very good afternoon, Dr. Ahmed. Thank you so much for joining us, Dr. Saab. Ladies and gentlemen, that's Dr. Muzaffar Ahmed, former member, National Disaster Management Authority, a person whose profile and whose portfolio included the chemical and industrial disaster management at NDMA, who's really been a strong pillar in the entire ecosystem of disaster management in the country. Good afternoon, Dr. Ahmed.
Good afternoon, Rubab. Good afternoon. How are you? Namaskar. Actually, I was not getting on my laptop. There was some problem in connectivity. So
No, thank you so much for joining us, sir. Thank you.
Thank you. Thank you.
Hope you're doing well, sir.
How are you, sir?
Very good, sir. Very good. Doing well. We are doing well, sir. Thank you so much. Your blessings. Thank you. Dr. Ghosh is also with us.
Yeah. Wonderful.
Yeah.
Wonderful.
Sir, namaste.
Namaste, Ghosh. How are you?
I'm fine. Okay. So, sir, just now we are starting.
Yeah. Okay. No issue.
So, some just a welcoming thing. We have more than 200 participants now.
Yeah.
230 participants. So it is the right time. Of course, we are going to have Rubabji. Just only let me just say two things. Just welcoming only, and then Dr. Ahmed will give. Then I will present. Or
I think I can check with Dr. Ahmed if General Bindal is expected to join later.
Yeah.
Okay.
Yeah.
We can wait for a couple of minutes. We can wait for a couple of minutes. No issue.
Okay, Ahmed sir, we were thinking that probably if General Bindal would be joining us a little later, but and then probably meanwhile we can have the lead lecture from Dr. Ghosh. But I'm not very sure about your. So we could probably have your special address, sir.
Yeah.
I think that would be great. We would not like to hold you for long.
Yeah.
No, what? If we can wait for some time, maybe some more people join.
No, I think we can do that. I think we can have your comments right away, sir. So I would request Chandan Ghosh sahab to please formally welcome Dr.
Okay.
And we can request him. I will read out his profile once you formally welcome him, and then we can have his address.
In between, actually, my laptop went some. So then now it is okay.
No problem. Let's formally welcome.
So welcome to this 3 days program on COVID. In fact, the role of industries. In fact, that entire country, we know that how industries have been working together with academia and research, especially due to the impact of the COVID. So this three days program, we have planned to address the you on various aspects of COVID impact that we have been dealing with so far. More than 15, 16 months. And we are at the lull period. Nobody can say right now, now COVID second wave or whatever second shot or second surge that has gone. We may count for third or fourth. Nobody, no modeler, no statistician, no soothsayer or no astrologer. No one can say what is going to happen. And in fact, for so many days that after this shock that country has endured upon, along with all of us, many of us, whoever we know, everyone got affected directly, indirectly. So in this time, when it is a lull period for next COVID, or if it is there, at the same time when vaccination drive is going on faster and faster, and we are trying to keep that gap, that by the time we have maximum number of vaccination, maybe whatever third wave that we are projecting for almost a month, it may not be existent in our country or in the world. So that way, now the effort that going on along with the drug development and various other direct and indirect way of detecting the virus and its movement, and then checking its existence or its concentration in a small campus or in a family. So there are a lot of innovation has taken place. We would like to give you some tidbits of those development that which is going on across the country, across the world. At the same time, as we are living here in just few days back, we had World Environment Day, 5th June, every year it is being held. So eco-restoration is the theme. At the same time, International Decade also, even International Decade for Eco-Restoration also has started on the same day, declared by UN. So in that way, now it is our combined responsibility, whether we are as a family or in a society or in a community or even in industry. So we would like to highlight here in this 3 days program that how as an industry, as a bigger unit have acted, coped up with the COVID attack. So those kind of case studies and example we'll try to bring before you, how they have handled today. In fact, then tomorrow we are going to talk about how this COVID has even some other examples, including the environment also. And then what are the innovations that are taking place in our IITs or even in our private organizations, even some of the startups. Those will be discussed from IIT Delhi. Professor Vasant Masagar will be talking about the projects that government has handled or is in the group of deciding about giving oxygen concentrator production and whatever crises that we have faced. So those things that he is going to highlight. And not only that, we are going to have that what is the current status of vaccine program that which is going on. Even last month when we are discussing that which vaccine is better or which one is not, there was some dilemma. But now almost scientific world who are dealing with these things, they have made that any vaccine is okay. And you may know that now there are some politically misconceptions were also blooming in our mind, but those are being reconfigured and corrected in the recent statements of various way by our people. So in that way, but the role of industry that we would like to see. So we have one person, Professor Ramchandra Kamath from Kodagu Institute of Medical Sciences. He is going to tell you how vaccine program is going on in the country and how the expected or unexpected third wave impact is going to be checkmate by our current progress of mass-scale vaccination, not only vaccination, but also drug developments and as well as some of the IT tools and manufacturing facilities that being generated due to the COVID, that where both government, private, and everyone is there. So I will say we would like to see that in these 3 days of interaction, you are going to have a good understanding of what is going on in the country and what is going on across the world. I hope you will enjoy these 3 days. Please be with us.
Thank you, Dr. Ghosh. I think we can invite Dr. Ahmed for his special remarks now. Dr. Ghosh.
So Dr. Ahmed, who is he's there?
Yes, he's there. He's right there.
Yeah.
है ना? So we can have.
इनका लगता है कनेक्शन कुछ लग नहीं रहा है ठीक से.
अभी
connection is halted. Oh yes, sir.
He's perfectly there. So,
I
Dr. Ahmed,
think there's some problem with the connection. Now, am I audible?
Yes, you are audible, sir. Yes.
No. Thank you.
Yes.
Thank
Yes, you are audible. Yes.
Yes, I must again compliment
We've lost you.
you and Bharat and Team Akhil, Varun, Sanjeev, all many this important training course. We have been having training courses for the on very important subjects which are as we know as our the training courses concern.
We are losing your voice, sir. It's cracking in between, sir.
Now they suffered a lot.
Barely hear you. I think there is some connectivity issue.
People have started preparing which created crack.
Dr. Ahmed, your voice is cracking, sir. We are losing
Whether
your
it was
voice.
fertilizers, whether it was steel.
There is some bandwidth issue.
For human mankind, but and you see they have to take care of those, and we also adjust and make our system is hello. It is important that we save human lives, make our industries Chandan Ghosh was about vaccination. Hello. Okay.
We apologize for this technical glitch. I think there was, the bandwidth issue with Dr. Ahmed.
Am I audible? Am I
Yes,
audible
sir,
now?
it is slightly. Yes, sir, it is slightly better now. Yes, we lost most of your, important speech, sir. Maybe perhaps we could have. You could reconnect. You can sign out and sign back in. I think that will be better. And
Okay.
we can work at the back end with you.
Okay.
We can work because there were some very valuable inputs which were coming from you, sir, which we do not want to miss out on. So I would request my colleague Varun to just get in touch with Dr. Ahmed, and we can have his speech a little later, maybe after Dr. Chandan Ghosh finishes his lead lecture. So Varun, if you could immediately speak to Dr. Ahmed, and we can have his address slightly later, maybe in between the two presentations. Dr. Ghosh, do you think it's the right time for you to intervene and present your lead lecture, sir? Perfect. So you can share your screen. Meanwhile, I'll also try and connect with Dr. Ahmed and get it sorted. Dr. Ghosh, you are on mute. Sorry, ladies and gentlemen, for this technical glitch. But we'll make up for it, don't worry. While Dr. Ghosh is just setting up the presentation, let me share with our audience, which is almost 250 plus now. I just would like to share a brief perspective on what we are going to discuss and what we are gathered here for. What began as a health emergency initially during 2019 is now rapidly threatening to turn into a global economic crisis. Containment measures have shaken the foundations of the three main pillars of the global economy: the demand, supply, and finance. There is a need for a comprehensive evaluation measures to significantly slow down infection rates, which is necessary to reduce the risk of exacerbating the ensuing economic downturn. And I think vaccination here plays a very, very important role, and our country and our nation and our leadership. Honorable Prime Minister himself came out a couple of days prior to make a pledge that the vaccination would be made available to one and all, and I think that is the way forward to deal with this current situation. The impact of this crisis and country's ability to cope with it varies considerably. While some countries are better prepared to cope with the pandemic and its impact, others are struggling to deal with either the COVID-19 outbreak or its impact, or with both. The scope of the pandemic's impact is not confined to the national level. Differences in impact will be observed across industries, firms, and households alike. And I think the role of industries, as we initially said, has a very, very important role to play in the entire aspect of dealing with this problem. On this note, I would now request Professor Chandan Ghosh to make his presentation, his lead lecture, and set the perspective for the coming 3 days. Over to you, Dr. Ghosh.
Okay. Thank you, Rubab, for this wonderful session that just started. Sorry to have some initial glitch in this converting the file and this. So today my topic is on COVID. Of course, COVID I'm showing by India map here. So COVID outlook, innovations by education, research and industries. And the photograph that gives you a very vivid as well as very painful recall, remembrance, just not even a month, that it is fresh in our memory, to not to relive these things in this manner that we have faced, but in future with industry, academia, research, and then our governance, funding, startups, and then our IT industries, and then communications, and that kind of industrial 4th revolution that taking place across the globe with artificial intelligence or with the virtual reality or with the data kind of infrastructure that we are now grooming ourselves to face even much bigger challenges than what we have faced all in a sudden. So these are not going to come in, and for that, whatever fight or whatever effort that country has made, this entire program is going to deliberate on this. Just this is one of that fascia, you can say, facade. You can say that our country, brothers, sisters, and everyone that we have fought, and we got this crisis, which suddenly created due to the tremendous surge of the COVID, which was unexpected, unprecedented. So whatever way you can describe, word doesn't seems to be just describing that seems to be not enough. But now it is the question for mitigation and management, that too with all industry partner, academia, research all together. So I'm going to give you a brief background that what it was and what it is now, what is the future, to take you to a few of the slides that I have procured from the various sources. So it will go down in the history not as a large health and economic crisis, but also as a driver for digitalization and innovation in fields ranging from healthcare to manufacturing. So then not only that, it is a crisis like this creates far more with the hope, as I said, crisis like this creates a far more stimulating environment, far more stimulating environment for change than economically stable times. Economically stable time. So the kind of momentum that we have got, this is going to make a far-reaching change, and including our environmental change that we want to bring for the sustenance of the sustainability in this earth, not only for us, but all global people as a family we have to nurture. So for that, what are the things that we want to bring? First thing is, you can see everyday newspaper report that in Delhi is getting choked. In fact, tomorrow we are going to have more intense discussion with Dr. Pandey. But where comes the role of industry? Because when it becomes a air pollution, then where is the role of industry? You will see hundreds of industry are involved to take on the problem of pollution, hundreds, thousands, whatever it is. But today's discussion, I will make you to that. What about those thousands of things in the COVID time that industry has come forward? Is one of that is identifying carbon dioxide concentration in a room where I am sitting now, or you are where you are. So carbon dioxide concentration like PM 2.5 or PM 10 or air quality index that every day in the internet that you get wherever you are or wherever I am sitting here. But Delhi becomes hot news, especially in the month of November, December. But after April, when the season changes after April, you may see that how these air quality indexes along with the COVID has jumped higher and higher and higher, even though it has gone 10 times, 20 times, whatever it is, but we somehow survive, maybe carrying. Inhaling virus, of course, created such a havoc things, but we have been habituated somehow taking 20 times of normal, say, level of PM 2.5 particles. But we have taken them, but what kind of health implication it is going for all of us, we don't know. But at least we have certain kind of detector now, at least by having a wireless or by having some kind of survey of carbon dioxide concentration in a house, in a room, or in a society, or in a community, or in a hall, where we can see if carbon dioxide concentration level is more than 1,000. Generally, now it is globally it is said 417, but if it is twice of that, if it is beyond that, then one of the research article came in is that if it is more than 1,000, then chances of aerosol borne like that it has happened, community spread that has taken place because it has become aerosol borne, then chances of getting aerosol borne COVID is becoming more and more, higher and higher. So we have got certain device with which in a room or in a community or in a hall or in an office with a panic button, if carbon dioxide is going beyond 1,000, at least it should give us in our mobile or in our computer, in our server, a panic or one kind of indication it will give that please open the doors and windows and have some kind of air circulation. And then that when due to air circulations and other things, then carbon dioxide level will come down, then spread of COVID, this time that when it has gone into most of the family members got affected, that could be checked, but nothing is sure. But we have certain small handy device, even it is going to come to our smartphone also to check that wherever we are, at least it will have a check on one of these from the environment where carbon dioxide concentration it will tell us. Of course, these days now smartphones are giving several such things from our body also, 15, 20 such parameters that it is giving through our smartphone. So let us see that. So in that way, now coming, whatever the small device can detect carbon dioxide concentration, or through an Aragya Setu, when we can check the movement or and by making it through Bluetooth, in our smartphone, we are able to check that where concentration is occurring and whether giving some kind of automatic, signal that don't go there. You are reducing the distance 6 feet or 7 feet. So in that case, the mobile or wherever people are getting, in one places, now technology has come forward in our country itself also, that if you are having corona positive and going to some non-corona positive area, then also it will give a signal that to the mobile and to other people also, because that one person with corona positive is coming up and they will get it notified or given the signal or some kind of alarm will be given, so that at least the kind of things that lockdown, distancing, social distancing, mask, whatever 3-4 things that have been made really rigorously still to be followed. So those are the things can be beautifully or more, control that we can have to check the or to break the chain of coronavirus. So I'm not going into those details, just showing you that these are all possible now. So as per existing data, the COVID-19 is estimated to be 1.4 to 614 R0 or not, with an average approximation of, say, if you say 3, and that is higher than the Ebola, but lesser than the Zika virus or measles. You see how fast, how much is their virulent they are. This number indicates how much virulent they are. And so lesser the value, then not that much of infection potential is there. So lower the value, less would be the infection. But when it is compared to 1.4 or something, even measles have got 11 or 18, so it's a much more, infection power is there. So then HIV and other things. So these are all just, I wanted to show you that when this research has come out in 2020, so you can go into the details of these things. And another publication claimed that COVID-19 is less deadly than other outbreaks like SARS, MERS, Ebola, but the transmission of the COVID-19 has appeared easier than other infection. This is what this paper says. Social distance has been recommended by the WHO to control the spread among the public with the imposition of necessary lockdown. You will get several such things. Just I wanted to bring from the academia side, because my background speech here, I want to say academia, then research and industry. Just I said that what academia has been doing. I'll show you something more also in this matter. Just wanted to show you in the academia part, global literature on corona disease. Of course, you are from the industry, I suppose, but since this is open, just it is a screenshot taken today, WHO website, global literature on corona disease. Of course, corona disease is not only COVID, it is SARS-CoV-2, but before that also it was there. Since 1960s, it is there. So you will see a number over here. So it is about 278,000 or 79,000 related publication is there. I simply mentioned here one or two just to tell you the taste of that how scientists have been working around the clock in several laboratories. 278,000 such references are available from the WHO side. But if you put the same keyword in the Google, it may be some billions will be there. But it is specifically World Health Organization, global literature on coronavirus has so far detected or recognized or listed 278,930 such authentic literature which is being published. And also, you can see I have got even a little bit more thing just to catch your attention in this area on the academia part, that one thing is corona infections, so many, these are the number, pneumonia, viral, pandemics, coronavirus, about 2017. And so these are the numbers of references or publication which are authenticated by this website and WHO maintained by website. And which are the most important database for academia? Medline is all doctors fraternity, they know. Scopus, all of us, we are having our papers published with a Scopus rated journal or impact factor journal, something like Web of Science, and then MED-R14, something like the ProQuest Central. So these are the numbers indicating in a little more that where academia across the world that they have been continuously trying and making the research, data, publication, discussion, course, and then training, testing, experiment, even the vaccine development also. How many things are required in that? It is really marvelous. Most of these things are available. But most important, again, another aspect that I want to highlight, which you may know, it is all taken from the available information that N95 masks, what are the types and to what level N95 does, all these specifications are there. And in this case, that N95, which is more famous, 95% of airborne particles. Of course, it is said they're not resistant to all. These are all hyperlinked. If you go there, you will get more details over there, which are there in the net. And then, who are the manufacturers? Actually, I wanted to just highlight here, pinpoint over here. It is only mask. Mask is being made even in villages. Every IITs, every NITs, or every household people, they have used mask. We have seen last year that how people are using handkerchief or even some paper or something, how they are making, even socks, even shoe or socks, how it is being made, and how dupatta is being made, used as a mask. But when you go at the research angle, at the academia angle, and in this context as a manufacturer's point of view, these are the alphabetically arranged A, B, C, D, E, F. These are the company or manufacturers where each one is hyperlinked, which you can see that who are the manufacturers. So I don't want to give any technical details about the mask, but see that one side academia, how more than 278,930 such publications are there, and in each publication minimum 1 to 10 or 20 or 30 authors, co-authors, researchers are involved there. So see the volume of people, those who are in the academia who are involved in corona or COVID related publication and research. And not only that, for the N95 is one of the maybe 20 or 30 such items being, or 50 items that which is just only one of that is only mask. So mask 3M is a very, very well-known company. I'll come little bit more detail later, established in 1902. But 3M also produce mask. You can get everywhere and less than maybe 100 rupee per piece. But we are producing mask even in our household, even 5 rupee, 1 rupee or something, 10 rupee market price. So all these definitions are clear. There are 95, there are 100, 99, but there are some, again, R is airborne particles somewhat resistant to all. Oil, this is N95 is not resistant to oil. When you say P, particle, filters at 95%, 95, filters at 99%, P100 filters at 99.97% of airborne particle is strongly resistant to oil. Strongly resistant. This is this. Even there are 110 also. You see Japan, 110. So they have all different specifications. So, and there will be at least 50 standards are available. This is about the manufacturer. But what are the standards of manufacturing N95 masks? So there are series of standards and protocol and type of material, manufacturing process, stitching process, sterilization process. These are all involved, which you can see that if you only concentrate on making N95 standards given by NIOSH, National Institute of Occupational Safety and Safety Hazard Health. It is an American institute which gives all this specification, gives all this permission. So if you see the standards are there, there are hundreds of standards are there which follows this protocol developed by NIOSH. So of course this you can see, but only I would like to say that each and every one, you are being from the manufacturer side, you know, when I write BSI or SI mark, how it is to be put and how it is all being defined even for a mask also. So you can see that when these standards will follow in our country's context, if a mask is in market available for 30 rupees these days in Delhi minimum, And when such kind of mask is made available 90 rupees, 95 rupees, if someone is giving, say, 60 rupees or 50 rupees, putting only N95, then you can think that what kind of products that they are putting, or what kind of standards, or where they are put and what are their meaning, then we can check and verify their authenticity at the same time, that which is already defined in this diagram. So let us come. This is about this is DIPCO is intended for the qualitative detection of immunoglobulin, G, IgG, antibodies in human serum or plasma, which will target this one antibody. So there are, it offers a significantly faster turnaround time. It requires just 75 minutes to conduct the test without any cross reactivity with other diseases. Without any cross reactivity, please mind that, because one medicine we are taking something, the pharmaceutically, the products that when we take, that it should not have any other cross reactivity with other, except few of the drugs and medicine. Of course, Professor Ramchandra Kamath, day after tomorrow, he is going to explain all these things. So kit or whatever is specifically meant for testing COVID, like DIPCO when that developed by DRDO, it should not have any cross reactivity or anything. So drug development also is a huge process in pharmaceutical industry in our country. Several thousands are there. They do these things. So so this kit has just shelf life of 18 months. So this has come to the market, and it is all taken up for mass production, and which is being made available. The most important news of few days back is about the anti-COVID drugs developed by DRDO. And this is again, I'm not going into the technical details of the drug, but it is again development and bringing it to the market, and then usage, and then making it really effective here industry. It is where that industry play an important role. So how it is doing, how it does, it is all given in many of the publications that available, or news reports that available in the country. It is developed along with, Institute of Nuclear Medicine and Allied Sciences in Mass in New Delhi, and also Defense Research Development, and then Hyderabad Pharma Company. You see, Pharma Company, then DRDO, and this, then mass production. Now they are looking forward to go for mass production, and for this drug, as well as for this one also. They have got now, they have got expression of interest to give the patent waiver and to give it to at least 50 companies across the country to make a mass production of these things. So as far as when it is developed in our country, when our government is, and our say drug control organizations are there, so making it a multiple use, multi-production, then there comes the industry, and then patent waiver or everything. It is all being modulated in our country as much as faster that we can get it, and then produce it in affordable way. So how it does, it is all explained, but I'm not going to this. And this is that 2DG, that which is being developed. Now, thing is, what went wrong and how to realign our troops against COVID. So far, we have been familiar with, we have been all these instruments that which are available, heartbeat or temperature, and everything is being challenged, and then we are able to see, doctors are able to see, but what we are facing, the mucormycosis kind of things, or black fungus or something like that, where, still we do not have any answer to that. But this drug have proved with some phase 1, phase 2 trial, which is just over, and phase 3 trial also. So it is giving wonders. Now we have to see that if this is developed, then whatever third wave or fourth wave that we are contemplating to come, because I said that this is a lull period now, and still up to 30th June, the containment the precautions and everything have to be taken. So COVID-19 pandemic has dramatically changed our life. So from mandatory mask wearing to safe distancing, testing, tracing, and isolating cases so as to outwit, outplay, outlast the virus. But now we are completely taken aback with an awe, worry, colossal loss ever have affected the mankind. So, pandemic effect in industries has created an unprecedented situation in manufacturing sector, which we all know. Many databases are being published now. We are coming to know that every tidbits of that, where that index is going down and where is the potential, then you have to reconfigure now when unlock starts. Then resulting from mandated lockdown across the global ecosystem, not just local or regional ones, as in the previous disaster. So supply chains are disrupted, and now we have to come back again, that stopping the flow of materials. But over and above that, we have to have the drugs, we have to have the proper way, methodology. Of course, not that only palliative care to be taken, we have to have a interventional care also is required to fight this kind of coronavirus or its infection. So now, so that is what that I wanted to say, that industry role characterized for the manufacturing technologies applied along value chain, where the connectivity, data, computational power, which is now recently, you know, one Indian graduate of IIT Kanpur, he has he has worked in European country, Finland, and then he has developed quantum computers along with their lab and facility. That it is a quantum computers are 10,000, 20,000 times faster than what our current computers or laptops or desktops are. So it has got computation time really. So we are going to have welcome 5G, 4G, 5G. So all this integration needs a computational power, and then analytics and intelligence, which is going on entire country. Of course, this is a case study taken from the McKinsey and Company. Just then machine learning, advanced artificial intelligence, all these are going to come and being taken up in Industry 4 development. And human-machine interaction, how you see it has revolutionizing our way, and how many of these technology are being focused to detect the COVID and COVID-related things, which I'm going to tell you a little bit on that. Virtual and augmented reality, robotics, automation, and then augmented reality, then advanced engineering, additive manufacturing, renewable energy, nanoparticles, you know. So now our mobile smartphone, now which we are getting these days, they are now making or able to make the circuit or whatever the chips that they are designing at 5 nanometer is a level that they have gone. They are able to make the electrons or you know, they have to make them, codify them, align them to the need, where computational power, human-machine interaction, analytics and intelligence, as well as advanced engineering are required. So while we are going through that, what are the COVID-related innovation has taken place? Because today I want to see that without innovation, no manufacturing, nothing. Innovation, compassion, and passion. Innovation, compassion, patience, and the crisis that we have faced. That gives birth to, you know, to reshape our way of looking at the present and looking at the future, to be more and more ensured that it should not be that deterred by certain kind of virus or anything that which we have been facing for the last 1+ years. So in that case, when we see the innovation, there are more than thousands of innovation which are being listed over here, in this 12 category. So one group of people, they have tried that how many innovations have taken place after COVID-19 impacted us. So globally, they saw, and I want to show you one of that whether it is a prevention, whether it is a treatment, whether it is a testing, whether it is an emergency communication, whether it is like Arabia Setu and something, humanitarian assistance, I'll show you some of these examples, whether it is a transport, then whether it is data, WHO data, Jeff Hopkins data, our India government data, CoWIN data, all are data, and then modeling and statistics. Then whether it is in education, the revolution has taken place in the online learning, the way we are interacting with you, and then enabling community and connection. Now we have learned that how to make each and every household or in a community into a hospital bed, at least some essential supply, which are affordable by each and every people living in a community. So whether it is economic and workforce support, whether it is vulnerable groups. In fact, we wanted to have one such lecture, but unfortunately could not have tomorrow. Then what are the policy related shift or policy related changes are being in? So they have got, in fact, several such things that they have listed. I'm not going into those details, but where India comes, just this photo is really attractive. You see, you might have seen in the many of the social media, Advik helping people in need. He is helping his mother in the household, that food packet with a message that he is giving. So this is also one kind of, enabling community and connection. Where even our children, they are taking part in a family and to spread the awareness. Khush rahiye, food packets and something like that. So innovations in COVID-19 and the extent to which people have been uniting around the pandemic and seeking new solutions are a vivid manifestation of this. So I said that there are thousands of innovations are just listed over there. And then in those 12 areas or many other areas that you can think of. Well, startups are trying to find their place. Like startups means, manufacturing or industry startups. To find their place under the sun amidst corona-ridden world, incumbents were also exploring new windows of opportunities. So, in fact, till December, there are several thousands of startups. They have to close their, venture because of economic blockage and many other travel-related things and other things. But now we see that. What are the kind of innovations that has come in? Like when we are having a corona patient, we are checking corona patient. What is the distance over here? Not even a feet. So in that case, regular stethoscope checking will create both patients and doctor vulnerable to the infection. But when we see that if we can make use of our digital stethoscope, which is there already in the market, and then communicate with the patient with a safe distance. So it is our Indian startups that IU devices they have made, then at least maintain such a distance and have such kind of surveillance where this infection range can be beyond at least to the doctors. So whoever is infected to check that using Wi-Fi or using this kind of communication devices, we can make wireless. And you have seen many of these wireless devices in our medical shops and many other places. But these are all the innovation have already done, and it is already done in India and in many other places. Or even you can see that if you want someone who is COVID ward, you want to check in a COVID ward, all are COVID patients. So this kind of things is not possible. So when it is a COVID patient ward, so still doctor can check, but sending that assistant staff or nurse in such a way that they can have this kind of with all protections here, but doctors is not affected, or at least in a safer distance. Such kind of devices are also already made. And we already know such kind of devices are available in the market, like mosquito or all these insect using household pest protectors, using this kind of signals, electronic system or button or anything. But you would like to see that, you see that this is from the world literature, at least I have not seen here. Even mask can be as transparent as this, which you can see. So clear mask. The mask can be as transparent as like this. These are also devised, and then it is, of course, it is taken for Itronics. They have made a list of all these innovations that are taking place, and also hand washing fact checker. You see, we are doing hand washing in our own way, 20 seconds, 30 seconds, sometimes no, nothing. But whether it is perfectly done or not, this is again another device. So you can think of the line of industries when COVID vaccine, making a COVID vaccine has got more than 360 such items connected to that. So making one such devices by the manufacturing industries, you can see that there are so many other correlated supply chain are to be there to make such kind of system also available. Who is going to check that whether it is perfectly done or not? Or like Arogya Setu that you all know. And then whatever is today that Arogya Setu is showing. But one thing is not over here, that when you are there, which IIT graduates have developed recently, a few days back, is about that when you are having Arogya Setu, I am having Arogya Setu, we have given vaccine, and Arogya Setu is checking that if you are positive, then wherever you are going, it will show red. Then someone is checking in the server that where is the concentration. But at the same time, instead of checking someone, when this device is there in the mobile, then another mobile application has been developed recently that it will automatically tell that if you are going near to someone with corona negative, it will tell that please don't go there, or it will give you certain kind of, like we have the speed checker in which is now made a part and parcel of even Google, that, and there are some apps are also there. So this gives that kind of warning or that kind of things that whenever corona patients are there, not, or you are having corona positive, but you are going to corona negative people, and that there's a chances of infection, all those things can be categorically now being arranged or devised by our Indian IT. Then there is something like this is called Corona One app. It is in German, they have developed, but we have also developed now like this. And whatever innovations that which I have shown, you see, it is, they have also listed Kenya 125 innovation, but 20 are already recognized innovation. Uganda 112, 15 are recognized. India 97. This is only one such record. It may not be the entire thing. 16 are recognized. But note down here, Korea, South Korea, 48 innovations they have made. 46 have been recognized. Only this is what just I wanted to note here, nothing else. Now, I wanted to tell you something about the this. Okay, I think I have to finish. Yes. There are something interesting things that 3M, how they have developed Minnesota Mining and Manufacturing Company and how they came forward. So what is their CEO says, purpose-driven enterprise, we know we can grow our business while collaborating to solve some of the humanity's greatest challenges. And we know that innovation is not innovation without sustainability. They have made a record for the last 16 years, sustainability they have maintained, which is itself a record in 2017. Before that last 16 years, they have been able to sustain. There is no something like this. They have grown like that. So then students at, just I wanted to, just 2-3 slides, students at IIT Roorkee have developed a Pranavayu at a low cost ventilator in association with AIIMS Rishikesh, which is just 25,000. Several IITs and organizations they have done. Safety button has been developed just like a pendant button for our say ladies that Parash Batra, Manik Mehta, Ayush Banka, or this I have taken from the things that information that available. Delhi-based startup, they have developed. If you are in difficulty or something, just press this one twice, then it will go to the mobile phone and then it will give a signal that some panic situation is there. So this is this innovation is itself unique, but taking it to the more commercial level, I want to show that some of those buttons over here. Initially, I have shown that they can detect carbon dioxide. They can. These are the things already developed in the market. Here itself, they have got this with foreign collaborations and everything. So they can count the people. They can track. They can air quality sensor. And they have everything wireless. There is panic button, industrial application. You can see this one, industrial application, and you can have call button. Everything is being synchronized, and this market, this product, these things are highly they made in such a way that even if you throw in water or even in fire, they will not burn out. And they need only single battery or 2 battery. And 2 battery can give this energy here for more than 5 years. You don't have to change anything. AA battery or AAA battery is more than enough to maintain this functionality. Even under root conditions or any environment, they can work there. So some of the applications you can see in City Walk Delhi that they have done. Just I have taken the snapshot of that. City Walk Delhi, then City Walk Mall, even in the parking and everywhere, this panic button has been established. Or even in Chennai City also, they have established 24 panic buttons at different stations, which you can see. And then, of course, I want to say that there is an enormous way that we should reconfigure ourselves. It is rather rebooting ourselves to live the life. And in the what are the 80% of the Fortune 2000? So many items, whether it is healthcare, whether it is aerospace and defense, and so many, whether it is a medical device, whether it is in technology, everywhere that we have to work. Then whatever is today or few days back, which has come down, you know that when second COVID research was there, we are not, there are many modelers, they say that it will be coming in June or it will be coming in September or something like that, but all has failed. Not that model has failed, it is because the data input were not that much. So now whatever is the vaccination, which you can see every day, you can check that what is the percentage that we have reached as on 8th or 6th June, something like this, and you will get more such details day after tomorrow. And these are all whatever world database that what is going on. And then digital stethoscope, I wanted to show that which has come now, digital stethoscope with distance and even Wi-Fi with Bluetooth, this can be operated. These are all innovation have taken place. 3D printing, and then 3D printing, you know, it has made a huge impact onto our way of living and making Industry 4 or making now modular system, everything possible. Of course, this is a Google map showing information sharing. Then, of course, about this will be a special lecture from Railway on the last lecture by National Academy of Indian Railway. Professor Bansal will be there, Gaurav Krishna Bansal. He will be talking about that what Indian Railway has contributed in the COVID situation and what are the response that they have made on their own. So in the beginning, first section of lockdown cannot be considered a permanent solution, but we know that now we have taken a partial way and now we have got the taste of that. And then this PPE productions and everything have been done. So many things have been done. And last but not the least, that I would say that again, we have to come back to the nature to make our life really meaningful. Wherever we are, but we have to link with the nature. We have to see the air, water, and our land. Really, they have to have a correlation and sustainable. Then only we can live a happy life. Thank you. Sorry, I have taken some more time.
Thank you so very much, Dr. Ghosh, for your very interesting presentation. Something what I was really pleased was the emphasis on innovations in your presentation, and I think this is where the industry plays the most important role. I think government has its own strengths and limitations. The biggest mandate is to administer. Administration is their biggest role to play, and I think they've been doing a phenomenal job on ground. There are certain areas where I think it's where they fell short, but I think that's a gap which industries needs to fill in, and I think this is where the role of industries and private sector comes in and comes out with a flash, and I think it is such unfortunately and fortunately it takes certain setbacks and certain learnings to really realize this as a fact. And with the entire vaccination, I think the way private sector has stepped up in last 12 months, who would have expected in any era that we would have a solution in form of a vaccination, not one, but dozens of them developed all across the globe, and the majority of which would be developed in India. Who would have thought that? And I really believe in our country's strength, but it was a swell moment for all of us. In India, we are manufacturing perhaps the best vaccines in the world in the highest numbers. So I think this is where the private sector role comes in, and right now it has all the private sector recognition has been taken away, has been overshadowed by vaccination. But there are so many other things which went behind, on ground in entire management of COVID. I think, like you very rightly highlighted few very critical, very impressive innovations by our technical institutes, by our startups and organizations. I think they would remain the main strength of this country moving forward. And this is what our Prime Minister, Honorable Narendra Modi ji, he is also very categorically been stating throughout his tenure that startups, entrepreneurship, innovation, technology is the highlight of this country, and we must cash on that, and we must push that agenda as much as we can. And I think we as a country, we are going in that direction, and we would be the hub. We see ourselves already as a hub to provide solutions to global issues, to provide suitable, sustainable solutions for global problems. And I think this is where we are standing up as a country. There are certain areas which we need to work on to improve our response and preparedness. But at the same time, we must acknowledge and we must appreciate the fact that the world is also looking at us in expectation that we would provide some solid, sustainable solutions for future problems. Thank you so much, Dr. Ghosh, for that very interesting, very practical, with some very very fundamental examples you shared. It was more of knowledge, I would say, on the on the role of industries and the role of industries, which industries have already played and are continuing to play in this entire management of COVID-19. Thank you so much, Dr. Ghosh, again for that presentation. Very, very interesting. Thank you. We already are getting a lot of comments from our attendees, almost 300 in number. They're really impressed with the presentations, with some very interesting facts what you shared. And who would not be pleased to see Indian innovations being showcased the way you did. Thank you so much for that. Thank you. Ladies and gentlemen, before we move on to our next presentation, we have Dr. Muzaffar Ahmed with us. Thank you so much, sir, for staying with us. I'm sorry for the technical glitch which happened earlier, but we see your video very clearly, and I'm hoping that the audio would also be as clear as the video is. Can we do a quick audio check with you, Dr. Ahmed? Can you hear me, sir?
Thank you. Yeah. Thank you, Rubab. Am I audible now?
Yeah.
Yes, absolutely, sir. Absolutely.
Am I audible now?
And yes, you are, sir. You are loud and clear, sir. Yes.
Okay. Thank you, Rubab. Thank you. I'm sorry, there was some technical snag. That's why I couldn't speak and you couldn't hear me. Let me first thank you and giving me this opportunity to be here this afternoon for an important training course on COVID-19 and industries. Let me tell you, as we know, last year, the swift, rather spread of coronavirus pandemic, it came as a heavy blow to the world economy, as the world's largest manufacturer became the epicenter in many countries. And this was I would call it the worst pandemic in modern times. We saw stock markets panic and supply chain from China got severed, with countries announcing the need to disengage the dependency on tightly integrated supply chain from China, including India. As you know, we were all dependent mostly on even import from China, not only on chemicals, but many other things. The age of Indian manufacturing was heralded. It was believed that US-China trade war would lead to added windfall for India. And almost more than a year ago, it seemed certain that shifting global dynamics due to novel corona crisis had the potential to pave way for India into the manufacturing sector. In 2021, we saw the worst grip of a variant of coronavirus. Manufacturing in India virtually came to a near standstill as the sector with the maximum amount of backward and forward linkages, manufacturing crucially sustain and propels economic recovery, but restrictions on account of the surge in COVID-19 cases led to rather many issues in the manufacturing sector, and we don't know about the third wave, although the government is preparing and has many states are in the state of preparedness for mitigating the effect of third wave, if at all it comes. Import of heavy machinery and equipment on which our manufacturing and other industries are virtually crucially dependent has been going down. The import of these crucial goods is important for rather maintaining a threshold on output expansion, as many sectors that features in India's major exports are also in India's imports. Last year, India came out with a negative import list of rather defense equipment, and making in India gave a big push, and we hope that it will take off in a big way. And the biggest thing was the manufacturing crisis became worst, especially in our medium and small micro enterprises, where which is rather labor intensive and the lifeline of India's manufacturing sector. Production cuts in the manufacturing sector had a rather negative impact on the component industries, predominantly suspending operations for these medium and small industries engaged in small manufacturing. And I will recall a report on a survey which was conducted by the United Nations Industrial Development Organization, UNIDO, that after lockdown was over last year, manufacturing in India virtually came to a standstill for essential like rice milling and other sectors. And most affected industries were metal, chemical produce, automobile industries, equipment. In fact, the automobile sector, which was rather grappling with the new BS6 regulations, was faced with the shortage of spare parts from China, where factories were shut down following the coronavirus outbreak. And again, this created a big economic blow. And as per the parliamentary panel report, the Indian automotive other industry, it suffered almost more than 2,000 crores loss per day, and the job loss was more than 2.5 lakh people as a direct result of this pandemic. And the report also said that the major original equipment manufacturers have cut down their production more than 15 to 20%. And I must also add here that it was our automobile industries which came forward in manufacturing of our essential lifeline equipment like ventilators, like Mahindra and Mahindra was the first, followed by Maruti and other automobile industries. And we were, although initially were dependent on imports from China for our personal protective equipments, even all disposables, masks, N95, but with the challenge which our industries, this sector came forward, and the ventilators were not only manufactured for the needs of our country, but also they also had good business for exporting these ventilators to other countries. And in fact, many studies and surveys were done by leading, including the McKinsey, who gave the reasons for the reduction in the industrial sector growth during this pandemics and the economic loss, including the shortage of semiconductors and globally people shifting from one sector to other sector. And also we saw that the COVID pandemic attention, because our health system, which was not resilient to take such a challenge, because it came as a sudden, rather not as a sudden this outbreak. And we know the investments previously in the health sector and our social care systems were not that high, but now the government's policy has completely changed, with the Prime Minister announcing yesterday that now the priority will be how we improve on our spending and improvement in our health infrastructure. and also ensuring that our healthcare workers, other responders, and their employers are taken care. And what was mentioned by Professor Chandan Ghosh, the innovations which our startups and industries have come up for the necessary equipment required to combat this COVID-19 was again a good thing for our country. And I must tell you that number of innovations, what he also mentioned, if we say the DRDO coming in a big way for establishment of 500 bed hospitals in many states within a period of 10 to 15 days. And also the manufacture of vaccine, which started with 2 Biotechs and Serum Institute. Now more than 7 vaccine production sites are in progress, and we hope that India, which has been one of the leading pharmaceutical exporter in the past, will also be, as far as the vaccine production and vaccine export after meeting the needs of our country will be there. And now again, that what was mentioned about the Professor Chandan Ghosh about the challenges of mucormycosis or black fungus, where the drugs of amphotericin B, it has been now been started manufacturing by number of pharmaceuticals, Cipla and many other. What is important is going to be taking care not only the needs of our country, but also other countries whosoever requires these medicines for the control and treatment of the cases of this black fungus. And what was mentioned about the need for hand hygiene, what he mentioned, even if we get vaccination and vaccines coverage for full population, but we have to understand that COVID, it's going to be for some time, it will remain globally all over, unless and until we follow the safety practices of using masks, social distances, physical distances, and good hand washing practices, which are very important. We can reduce the not only mortality, but also infection of this pandemic. And the role of industrial sector is very important because large number of people, workers work, although number of initiatives have been taken for occupational health in these industries and in industrial sector, whether it's a chemical, petroleum, but we still need to do it and ensure that mitigation efforts are made and we save our workforce in our industrial sector and make our industries safe from the pandemic. And in the end, I must thank you, Rubab, your team, Akhil, Varun, Manik, for coordinating with Professor Chandan Ghosh of NIDM, whom also I appreciate and compliment his efforts, along with the efforts of Major General Bindal, Director NIDM, and our Chairman and Chairman of CIDM, General Bharadwaj, and other officials of our FICCI, whether Secretary General or Deputy Secretary General and other officials of FICCI who have taken keen interest for these training courses. And I'm sure we are going to will have number of such training courses in future. And what is important is that whatever you learn this here in these training courses, this has to be carried forward, this has to be propagated. And also we expect that large number of people will get benefited from these training courses, and we expect the people working in industry, in not only in industries, but universities, NITs, engineering college, will also attend our future training courses, which will be in the best interest of our preparedness and mitigating the effects of corona and other pandemics and other important disasters and public health emergencies in country. I must thank our resource persons who will be taking part in this our training course, and also the participants who are going to be with us for 3 days. And I wish you all the best. Jai Hind.
Thank you so much, Dr. Ahmed, for your very, very visionary remarks and very visionary address. I think uh, you've really given us a direction, right? And it was very timely also because after the presentation which was made by Dr. Ghosh, and your reactions to that and your uh, overall observation of the situation with your decades of experience, especially in the health sector. And I think it turned out to be the best timing for your comments. And we are getting some comments also from our audience, who are really excited to hear your thoughts, your perspective uh, on this entire subject. Um, while we are talking about, you also emphasized on innovations and how industry has stepped up. From a vaccination point of view, we are the vaccination capital, the pharma capital of the world. And I think the innovation coming out from INMAS, DRDO, what was mentioned in Dr. Ghosh's presentation, and of course, you also mentioned about it. I think this says a lot in volume about the scientific community of our country and the scientific, the brains of of our country. DRDO lab coming out with a magic drug, literally, and which of course it's a magic drug because, but then all these drugs and all these medications have to be administered at the right time. And I think if they are, what 2DG drug has been developed by DRDO and Dr. Reddy's are further working on it. Um, I think this would be a big weapon for the for not only for Indian community, but the world to fight any further waves of COVID which might, God forbid, which may come. And I think this is a very strong statement going out from the India's private sector, industry sector, to the world that we are no less and we are right there on the job, working hand in hand with the Indian government to provide the most suitable, sustainable solutions for global problems. Thank you, Dr. Ahmed. Thank you always for your inspiration, for your encouragement, and thank you for motivating us, the entire team at FICCI, the CIDM board. Of course, you are an integral part, and appreciating the humble work which FICCI and NIDM is doing together, under this partnership to develop better capacities within the communities, with a focus on industries, of course, but uh, also including other stakeholders like the academia, the government sector, state and central both, civil society organizations, and we are trying to make this into an inclusive platform where every stakeholder is given due importance. And I think industry will play a very important role, as we've been repeatedly saying, and we'll continue to work in the direction what you've shown us together with General Bhardwaj and of course Major General Bindal. So we'll continue doing the work, and as we say, the OTP, the quality of the OTP or the success of the OTP is as good as the number of people who attend this. And we are almost at the 300 mark, and there are plenty more on the YouTube channel, I'm sure, who are witnessing this. So I think we are doing a decent job, and thank you so much for your. We have some very interesting comments coming from Mr. Gupta also, who's a senior scientist with DRDO from Lakshmi Nagar. I think thank you, Dr. Gupta, for your comments. We'll convey your feedback along with other feedback we've been getting with all our speakers. Thank you. Thank you. Thank you, Dr. Thank you for your time, and sorry to keep you waiting, sir. And apologies for the technical glitch. Thank you. Take care. Moving on, ladies and gentlemen. Any comments, Dr. Ghosh? You would like to? You would like to?
You have made the full. Excellent, sir. Always your presence is always blessing for us, and please keep us active and alive in this COVID. Let third wave comes or not, we don't know, but your presence is an inspiration for us to work.
Thank you. Thank you. So we'll move on to our next very eminent and very important speaker, expert, industries representative, a co-chair of FICCI's Disaster Management Committee, and a very senior industry professional at one of the fastest growing corporate groups of the world, Adani Group. A very warm welcome and a good afternoon to you, Rituraj ji. Thank you so much, Rituraj Mehta from Adani. Thank you so much for joining us today, sir. I hope you're doing well. I know you are yourself a COVID survivor, a warrior.
Yeah,
and
that's right.
In your presentation, we would definitely during your comments, we would like to hear on that front as well, how well you are recouping. And I know it was a struggle, it was a difficult time, and we were all praying for you for your fast recovery.
Thank you so much.
Very good to see you back on the screen, although we haven't been
Thanks.
able to meet for a long time, but then this gives us as good a feeling as a physical meeting would do, until we actually meet. But then it's so good to see you back with us, sir. Thank you so much. We wish you the best of health. Thank you. Thank you for joining us. Ladies and gentlemen, we will have a presentation on the impact on infrastructure growth due to COVID-19, a very, very important and relevant subject as far as this OTP is concerned, by Mr. Rituraj Mehta, who is the Corporate Head, Safety and Business Excellence at Adani Power Limited, Adani Transmission Limited, Adani Infrastructure Management Services Limited. A brief background of Shri Rituraj Mehta ji. He's a corporate professional in the field of safety and business excellence with 26 long years and more of experience and exposure in major industrial business sectors like automobile, chemicals, textiles, cement, energy, and financial services. He has worked with renowned business brands like in India, like Aditya Birla Chemicals, Grasim, Ultratech Cement, and now Adani. A graduate in chemical engineering from NIT Raipur, presently he is leading the drive for safety culture transformation in thermal power, transmission, road, water, cement, and AEML business. A very vast portfolio which Mr. Mehta handles at Adani, and we are very privileged to have you to make this very important intervention presentation on the subject of your choice, which is very, very relevant, as I said, in this OTP. So over to you, Rituraj ji, for your comments and your presentation.
Ruwab ji, and good evening to all. Just share. Am I audible first of all?
Yes, absolutely, sir. Yes, loud and clear.
Okay. Is this slide visible?
Yes, it is.
Okay. So, Ruwab ji, it is always a pleasure to be part of a session, and it was also a great pleasure to listen to Dr. Chandan Ghosh and Mr. Muzaffar of their words of wisdom. It is always quite, we learn a lot from you, Dr. Chandan Ghosh. I have noted certain points from your presentation. As has been shared by Ruwab ji, I have recently recovered from COVID. So please pardon me for, pause in between to just keep hold on my breath because I was little bit hesitant to join this session, because it's only 15 days for me to get discharged from hospital. So, I was not confident that whether I'd be able to share my thoughts here or not. But what I did was I just noted down certain points. So it would not be a presentation, but certain points I would like to share with you in a form of a scenario of which our industry has gone through in the situation of COVID-19. Let me tell you about, first of all, my situation. 20th, I just got a fever. No other symptoms were there. So I contacted my doctor. He told me that till the symptoms come, you take paracetamol, and we'll see later on. Especially this, to my experience, the second wave of COVID is quite deceiving. There is no pattern. You will never come to know that from where you can get impacted, because with all precautions and other things, many of my colleagues in office and including me got impacted, and immediately family members and other people who are close to me are also got detected positive. And then another misleading factor was CT value in your RT-PCR test. So my CT value was 31. Doctor told me that it is a moderate value, because 35 normally you are supposed to be negative. So you don't need to worry. If you can get treated at home only, it will be okay for you. Another misleading factor was I got CT scan done, and the value was 9, which is the lowest value of your moderate category. So again, doctor told me that it is also quite moderate. You don't need to worry about. And that way, 3-4 days gone, and then there was a day wherein my oxygen level was quite down, and I was supposed to get admitted into hospital. And rest is the different kind of story. But my learning is very important point that COVID this time, the COVID variant was quite different and quite deceiving. Many of my colleagues in plant and the people who are living in remote area were find it quite challenging in order to get treated and understand the criticality or severity of this particular situation. So anyways, that was my story. And then few days back when I got a call from FICCI, I was frankly speaking little bit less confident about coming to this platform because of obvious that this breath control is something which I am still recovering. You'll be surprised to know that during the treatment, I lost around 16 kg of my weight. When I say 16 kg, most of the weight was reduced from your muscles of legs and hands. So, because of which there was a time when 15 days back when I was not able to stand on my own. I used to get support from other fellow to go to the washroom. It was the impact of all these things. But by God's grace and with all your kind wishes, I am here and happy and recovering fast. So here is my session, and I'm sharing my thoughts on it. So impact on industry.
Sorry to interrupt you, Riturajji. If at all, whenever you want to to catch a breath, please, we have a lot of time, and we have a lot of time in hand for you, because we at no cost of your comfort. Please do not push yourself. Take your time, and we can have this later also, because the audience here will get a lot of such opportunities. But please, please make sure that you catch your breath whenever you want. There's no hurry, no hurry at all.
Thank you so much. Yeah. So as far as the topic of this session is concerned, impact on infrastructure growth due to COVID, I found it very interesting and very relevant to us, because the group I represent is mainly into infrastructural related industries. You all know that we are into energy, we are into port, we are into waterways, we are also into roadways, gas, and mostly it is infrastructural related industries. So I'll start with energy vertical of our group, wherein I play a major role. When I say energy, it includes generation of energy, which is mainly thermal power. As of now, we are also now into renewable energy, and then transmission of energy, and then distribution of energy. So, as far as thermal power business is concerned, our generating units, we have 7 different locations, 6 different locations across India, which are operating currently, as well as we also do have one greenfield project in Jharkhand. So there are 7 locations, So as far as impact of COVID-19 on our infrastructural growth is concerned, I look at it in a different from different point of view. One point of view is whenever my operating units are performing and generating electricity, it is actually contributing to the growth of other related aspect of the country. Second is my own growth in terms of greenfield project when I am completing or in the process of getting the project completed. So first I'll come to the operating part. When I say operating part, again there are different contexts. There are industries and locations of our business wherein we do have remote areas with township available, wherein my employee or maybe other township or our business associates are there who are living out there. So quite challenging thing was during the COVID to ensure that first of all morale of our employee and their families which are living in township is there in order to ensure that they are joining the industry, doing their duty on regular basis and contributing their bit to the productivity of that particular organization. In addition to that, it was also important when they enter into our organization that we take care of their health within plant premises as well as when they are going back to the township or their respective home, and this includes business associate as well. So we were supposed to create such systems wherein from the gate entry to the gate exit, everything is being continually monitored, controlled, reviewed, and actions are timely taken in order to prevent any mishap to happen. And you understand that an industry like thermal power generation requires many, huge amount of manpower, especially when it comes to the overhauling part or any maintenance related activity. So first part was operation, where we were supposed to ensure that morale of the employee and our business associates were there so that they can come to our plant regularly. Second important challenge was, as I told you, that during overhauling and maintenance part,
Ritularji, your presentation is not moving forward.
So Rubabji, actually, I don't have any slide as of now.
No problem.
I'm just sharing. Yeah. Okay, thank you. So second part was the overhauling part, wherein you all know that a lot of manpower mobilization is required. So first challenge was manpower availability during the COVID time and certain lockdowns announced. It was very difficult for us to motivate our business associate to ensure mobilization and required manpower availability. So of course there was a challenge, and somehow we were able to, with our proactive actions, certain locations, of course they found some challenges, and then overhauling period was delayed for a few days, but we were able to manage it. That was another challenge. Third important aspect was when you talk about overhauling, certain machineries and equipments are required. When you're supposed to procure those things due to lockdown period, or maybe due to your condition of your vendor who is supplying machinery to you, you are not sure that those equipment will be available in time. But thanks to our systems, wherein we are supposed to have a check on availability of critical machineries and equipments, we were able to manage that also. Next important part was when certain locations were there where we don't have township availability, and those locations are also very critical in order to see that since township is not there, how to keep control and monitoring our employee and their family when they are living in township and not township, a small town, somewhere at rent, somewhere they have their own house, but they are scattered across the town, and you need to monitor them. You need to commute them from that point to your plant location, and then you need to again, send them back to their respective homes on daily basis, ensuring that while commuting, while they being their home, while being in plant, their health is continually being monitored, and we ensure that they are healthy, and also their morale is high. Next challenge was at our project location. Project location challenge was very different, because at some point of time we are having more than 10,000 contractor manpower at our location, working in different different areas within one boundary or outside of the boundary as well. So as was the case in operation, but with a big quantum leap, the availability of manpower again was a challenge, as well as mobilization of manpower was a challenge. And also, as you know that in project situation, because of remote location and huge number required, the people come from different states, different locations, different background. So, when it was announced and there was a situation when everybody was aware that this pandemic is impacting people, many of the contractor workmen, they went to their home base. And it was very difficult for us to motivate them, and again, motivate them, assure them about their health, and ensure that they are coming back to our site location. So it was there was an impact. Let me confess that as far as project activity was concerned, we found that it was not so easy. An ideal situation is not there. But nevertheless, our systems and our team, I would consider that industrial people who are ensuring that this project activity or operating activities are being functioned regularly, they are silent warriors. Of course, there are other aspects of our country when health warriors are there, which are frontliners, where police is there, they are doing their job in a very best way. There are other people. Likewise, our industrial people who are working at site locations, either in project or operating units, they are silent warriors. They are ensuring that irrespective of all kind of challenges, our plants are running, project activities are going on, so that we are able to generate electricity in continual manner. Another challenge was when we say that most of the manufacturing activities were cut down during the pandemic situation. The demand of electricity was also not very high. And normally what we do when the demand is not high, we proactively organize overhauling activity so that the time is saved. But this time when we were planning overhauling activity, which is not scheduled, again, the manpower availability and mobilization was a challenge, as well as the procurement of equipment. So this was about energy generation. Now coming to the transmission part. Energy transmission is a different ballgame altogether. Here you don't have big locations, good number of people available, or township and other facilities are available. The transmission, you have substations and transmission lines in different remote locations, wherein even nearby town you won't find many good facilities are available. So more than 33 locations are there across India, wherein we have substation and transmission lines. We have 10-15 people working out there. We have people who are supposed to take a round of transmission lines at a length on regular basis. So challenge was actually there to ensure that so many locations, so many scattered people, how to take care of their health, how to keep monitoring of their situation, their mental health even, not physical health only, because it was quite depressing for everyone. Whenever you talk to somebody, you will find that he will tell a story that some of his close relative or friend or somebody got impacted with COVID and there was a horrible situation. So with those kind of scenarios, keeping track on everybody and ensuring that their motivation level is high was quite challenging. I would really appreciate the concerned team of our organization, wherein what they did was they created WhatsApp group. They kept monitoring on, they created internal systems rather. And with the help of WhatsApp, continual regular monitoring was there. Whenever somebody was getting impacted, immediate medical help was provided by the organization, and it was ensured that how to keep those people, you know, exposed to best medical facilities available in their respective area, and if it is possible, whether we can shift them to our nearby major town so that more facilities are available. So transmission, again, operation part was there and project activities were there. So project activities, again, as was in the case of Jharkhand, availability of contractor manpower, were delaying the project activities for a few days, few weeks. So how to keep up with that? How to ensure that those delays are, again, we can keep track on those things, and we can have a plan B wherein we can work, we can make more efforts in order to ensure that those delays are again mitigated. So another challenge was whenever you have timelines tightened because of certain things and works are being delayed, normally it's a human tendency to bypass the safety aspect of their activity. How to ensure that even the jobs are delayed and they are now facing challenge in terms of timelines, so they are not actually bypassing the safety norms, and culture is developed so that work is done in effective and safe manner. Coming to the part of distribution part, distribution was something a different, again, a different ballgame, wherein you have multiple locations available, multiple people available. They are going with a shorter distance within a town, within a big city like Mumbai, and they are ensuring going to each and every area, chota gali ya bada road. They are supposed to go there. Either it is meter reading, either it is maintenance activity, either it is or it is coal related activities. Many activities are being performed on daily basis, customer complaint and other things. They are supposed to go there. In such scenario, wherein there was a time when somebody was not having full confidence to go out of his home, open the door even, but they are really silent warriors, which they have ensured that availability of power is continuous. No power cut is there because of our technical related problems, technical glitches, or because of our non-availability or poor performance. So those kind of efforts by our team, whether it is generation, whether it is transmission, whether it is distribution, is really commendable. And time will tell us that whenever we will be, still we are going through this phase. It is yet to be zeroed down, but we will, at some point of time, we will quantify all these efforts, and we'll see that how to appreciate these efforts internally, recognize their efforts, and people are rewarded for that. That's really important for all industry to ensure, and I'm sure all industry would be doing that. Now coming to the port part. So port, we have a pride in saying that while there was a time wherein availability of oxygen was quite challenging for our country, our port team has been able to procure oxygens and supply it to the government, so that the people are treated with availability of oxygen in time, and health of those people are improved. That was really a big thing. Many industry have done that, and our bit was our contribution was also there in terms of oxygen availability. Of course, there was a time I just missed out that point, that even in thermal power business or project activities, the oxygen supply, we, as mandated by government, we have stopped consuming so that availability of oxygen is there in country for the treatment of various people. So port, yes, of course, there was no activity stopped. because of this pandemic situation, we have made efforts. We have created systems to ensure that whosoever is coming into our organization is properly monitored, checked, and of course treated if required with proper medical help. Then comes the part of our road related activities. So road projects are going on in various parts of our country, and you know, road projects are impacted. I must confess that, because you will find that even in pandemic situation, road projects doesn't have any premises. It's linear project in nature. So you will find that across the length people are working. There is no boundary. So it is very unorganized, and it is very difficult for us to monitor the work being performed by various business associates. So there was a different kind of challenge was there, especially during the pandemic situation. So what we did was we tried to take help from technology, and with the help of technology, surveillance camera and other things, we have been able to keep a track on those people. And we also created certain systems wherein before health checkup, nobody could enter into our project activity. So this is how we try to do something to ensure that project activities are going on. Of course, some delay is there, but we are sure that we will be able to cope up with that. Then comes the point of other infrastructure related businesses, but activities are quite similar. Our proactiveness, our medical health facilities, monitoring, monitoring especially at the entrance point as well as at the exit point, and keep in touch with the people. So these things, these things are very important as far as industries are concerned. In my case, even when I was in hospital in ICU, my other 3 members of the family were got detected COVID positive, and I was very much worried because being an outsider in the town, we don't have any relatives or any close persons available. But then our company has made sure that our top bosses and other people, they were making daily call to my family, not only my family, but all the people who got impacted on daily basis, in order to motivate them and ensure them that we are with you. This is something very important, and that we are. I could say that almost our industry might be doing that, and we have a pride in saying that we work for a company like this. So this is, and my family also. When I came back to home after getting discharged from hospital, my daughter told me that one of the HR team member has talked to her almost half an hour on daily basis, just to ensure that they are confident, they are treated properly, their concerns are heard. So this is something which is very important as far as employee or even a contractor workman is concerned. So I guess that's all I wanted to share from my side. I'm sorry, this time I couldn't make any presentation because of the health related issues. I'm still taking rest at home. I'm working from home. So thank you, Rubabji. Thank you, Manakji, for giving me this opportunity to share my thoughts on this important topic. Thank you again.
Thank you so much. We can't thank you enough, Riturajji, for your intervention today, for your comments. And I think even without the slides, the point which you mentioned, I'm sure all of the industry representatives or even non-industry, people from the civil society, people from the government sector, from the academia who are present on this call, had a lot of learning from your comments, especially you shared the best practices. I mean, Adani Group leads from the front. I mean, we can count the top corporate groups of the country on our fingertips, and I think Adani is one of them. Adani, Tata, Ambani, the Reliance, all of these, I think have have displayed such courage and such they've really led from the front, and the examples of what you shared, is also very relevant, especially in handling your human resource in these crises. And I think this is the best example what one can get, when we are talking about role of industries in COVID-19 management. I think this is a very important point which needs to be highlighted, is that the human resource what you have is the real is the real pillar of any organization. And if you keep them motivated, you keep a track of their health, you make sure if they're affected that they come out of that, not only them, but from a mental health perspective, their entire family. And I think I won't shy away from saying that this is something which goes in interest of the company also in the longer run. So what the faith, the trust which you have in your company now or in your organization now is far more than what it would be about a month back. I'm sure it would be sky high even then, but now it has even reached to another level. And I think this is where the industries have to really stand up and work closely with all its stakeholders, where its employees is definitely one of the first and the key and the foremost stakeholder in the entire process to deal with the situation of COVID-19 or any such crisis. And I think you've shared some very valuable points and also some interventions which Adani Group did not only do it for itself, but even for the community at large. And I think our heartfelt congratulations to the entire organization, to the entire leadership of Adani, because I'm sure this is an approach which comes from top to bottom. Yeah. And I think this is where some impeccable and remarkable work which has been done. And I think for all the listeners, this is an important role of industries, apart from many other things, but what Rituraj mentioned. But I think taking care of your resources, I think is as important as taking care of the operations. And I think it is more important in situations like these, what we are going through currently in our country. So thank you so much, Rituraj, for those very, very interesting, insightful comments you made in your presentation. And we are so glad, personally, I'm so happy to see you. And I think, yes, we could really sense that you are still recovering. You were finding your breath, right? You were making the intervention, but I think you went with the flow. You sort of ignored any stress what you were going through. But we wish you the very best. Please take good care of yourself, your family, and continue to do that, because it's people like you, it's leaders like you who really make the difference. When it comes to dealing or combating with a crisis like what we are going through right now in our country and globally. And because Adani is now a global organization which has presence in many countries now, and very strong message coming out of your intervention. Thank you so much, Rituraj. And we can definitely see that you have lost a lot of weight, and I hope you get that back real soon. You become fit as you always have been, and we'll keep engaging with you and take your guidance and your suggestions moving forward in building this entire platform what we have created jointly with the Government of India. Take it to the next level and grow as a platform moving forward. Thank you so much, Rituraj, for your intervention and for your comments. Thank you.
Thanks.
Over to you, Dr. Ghosh.
Oh, it is superb that a live presentation, even though it is online, but you have really given your own experience with the COVID, and which I think it is such such a traumatic experience you had, but at the same time that expressing that openly to our platform over here, and at the same time that in keeping your company activity motto and health as well as workforce intact, that is really unparalleled. What country have seen in the first wave, and after first wave or when unlock started, what country have faced. But you have led your company silently, keeping intact with all resources and working capacity, and in all those, whether it is infrastructure, whether it is in road, in all areas, energy and everything. And so silently we can say that even after so many partial lockdowns, all still things are surviving. So it is all your work that which you have been doing silently, keeping your resources, especially the workforces and operation on. And probably this will not be counted in the GDP report or something like that of the country, but in your company and organization in various fronts that you have been working. And the kind of uninterrupted communication that we are maintaining now, or uninterrupted food supply or essential supply chain, that even in this 2-3 months that we are getting. So I think our participants also here, they are really happy to see that you have expressed more than PowerPoint slides by telling the really truth that you have handled. So thank you very much. And whatever physical loss of weight that you have, that we say that with our prayer, with all from the participant sides, we'll gain it more efficiently by spirit as well as by your tenacity to work hard. Wish you come round very soon.
Thank you so much. Thank you. Thanks.
Thank you, Dr. Ghosh. Thank you so much. Ladies and gentlemen, we are also, as suggested by Professor Ghosh during a last OTP, we are trying to experiment a new aspect where we would encourage our audience to mention their questions in the Q&A window, and we would hope, and we are trying to select a few. We can't select all of them. We would select a few key questions and like to bring the attendee live with us and ask those questions, selected questions, live to the speakers. We would, this is a message going out today. So we'll start this, we'll experiment with this maybe tomorrow, Dr. Ghosh.
Yeah.
Tomorrow we can try and take a live question. We would also, like Dr. Ghosh has already mentioned, that you may please raise your questions here in the in the Q&A box. We encourage you all to please don't shy away. Just whatever is there, any question is a valuable input, is a valuable feedback also for us. And any question which you ask, we will try and find an answer for you from the speakers or our the huge ocean of experts what we have as part of our panels, not only for this OTP but otherwise also. So we'll reach out to the concerned expert to get the right answers for you. So please, even if you have questions from today, although we are behind time today, we're just about to finish today's proceedings, but tomorrow we'll try and keep some time at the end where we would reach out to you parallelly based on your questions. We will seek your convenience if you would like to come live, if you would like to feature live here and ask the questions directly. So I think that's a fair way to go forward, Dr. Ghosh, isn't it?
Yeah. Sure.
Yeah.
One of the thing I think one Khatib Ahmad privately asked me, like in the, sir, may I know what is the size of coronavirus? I think size of the coronavirus. Of course, it cannot be seen by naked eyes, and that is why we have to use a mask. Now, you may ask that what is the things that in the mask that, of course, they can filter the particle, like they can filter the particles, and 95% of the airborne particle they can filter out. In that case, corona size, like when you see, this is the kind of thing, there are some pores are there, these pores. So these pores, like the shirt that I am wearing, that can be, of course, it is much smaller than what a hair thickness can indicate. So generally, N95 mask, if you see the details, of course, you can see in the internet also, 0.3 micron. So 1 micron is, you can say, 1,000th of a millimeter. So 1,000th of a millimeter, even 30% of that. So you can say that it is, of course, not visible. And because after all, the masks are designed in such a way that we should be able to breathe in. So air is much smaller because in the molecular level. So air has to pass in. Only the particles bigger than 0.3 micron should be checked by this. So coronavirus is also around that range. So that is why they cannot penetrate through the mask. That is why wearing mask is very important. And moreover, they are airborne. They can fly with the air. So that is why their particle size is so small that they are carried away this virus through the air. That is why this time we have seen that it has gone to the villages, one city to another city, and one person with another person. So that way you can see the size and more clear things that you can see on the internet also.
Absolutely. And I think there is a very strong suggestion coming out from the medical fraternity on which mask to wear and what when the wave is at its peak or when it has eased like it has now in India. The positive rate has really gone down to under 4%. So, but this is, as I said initially, the message coming out from the medical fraternity is very clear, very strong, that we can't let our guard down. The COVID appropriate behavior, all these terms are people at times get enough of it. We've heard all of this. Still, we could not control the spread of the virus. See, because the virality of this entire COVID-19 has changed. It is also evolving. So it is actually a fight, an ongoing fight. We are the defendants here. We are trying to defend, and and the COVID-19 virus is on the attack mode, and it is also evolving. The virus is evolving. The virality of the virus is evolving, and it is trying to penetrate through our defenses. So we have to be, better prepared moving forward. Vaccination is not the final solution. It is just a way to defend, as I said, the attack of coronavirus. Vaccination is just a layer of defense. It is not where the virus will lose its battle. It will continue to attack us. We have to be prepared as a community. What is herd immunity? You can Google it and you can read more about it. See, we have to be more and more people who get vaccinated who cannot transmit the virus further to another human being is herd immunity. And this is where we want to reach. And through proper vaccination, when majority of the population, about 75-80% of the population will be vaccinated, this is where that layer will be formed. Till then, we can't let our guard down. We have to continue with the COVID appropriate behavior, wearing double masks, maintaining distance. Some people now say that 10 feet distance is appropriate. If we are wearing a double mask, that distance still has to be maintained. And it is not only, will not only protect us, but even protect our immediate family, colleagues, peers whom we will meet eventually, because the unlocking has started again. People will start going to offices. 50% of staff is allowed in private offices. Shops in the market will open up. The shopkeepers are desperate. They want more and more people to come. There is no harm in going because the unlocking has started. But we have to make sure we don't flood the market with our presence if it is not required. It has to be still the same way. We have to go out if it is very urgent, very much required. We encourage also people to use for services provided by the small and medium businesses. We need to keep them floating as well, because they are really, they have really suffered in the last 1 year. So, but then not at the risk of our own health. So we have to ensure that we follow the instructions, we follow the appropriate behavior instructions of COVID, and we together, and the vaccination anyways, the government, the Prime Minister himself came up a couple of days back and he made such a strong statement that it would be provided free of cost to a lot of states. It would be available to everyone. I mean, I was having trouble last week finding the second dose of Covaxin, but I had a window of 10 days. And come Sunday, the vaccine in Delhi, Covaxin in Delhi is flooded, and all of that is free. My compliments to the Delhi administration also, which is working very closely. It may not look like, but they are very closely, working very closely with the central government to ensure that they have enough second doses of Covaxins available, free of cost, which I think is a huge, despite the trouble we are going through, the logistical issue, the supply chain management issue, still we could afford to make this huge numbers of vaccines available. I think commendable job by the government. I think we need to also support them in this endeavor by doing our bit, by staying safe, not being complacent, even if we are vaccinated fully, that is, even if we get 2 shots. A certificate of fully vaccination doesn't mean that we can go out without masks and we can move out. And I think this is the role of individuals. This is the role of communities in managing COVID-19. And I think when we are talking about COVID-19, role of industries is nothing but the communities also, because the communities work in the industries. And I think all of this has to come up together. I would request if Dr. Ahmed, if you can hear me, I hope, I don't know if I'm audible to you, Dr. Ahmed. I think maybe not, but he's a medical professional. I may not have a very credible background to say on medical lines, but all of this is information or knowledge we've learned from General Bhardwaj, Dr. Ahmed, Dr. Guleria, and Dr. Mishra, the former director at AIIMS. I mean, all of these people, they've been maintaining this at the national level. So, we have to support. We are a stakeholder as a community in this entire process, and we need to play our role very diligently and more effectively to deal with the COVID-19 crisis. So I think, Dr. Ghosh, I think we've already gone past our scheduled time of 4:30. We come back tomorrow for a very interesting session where we have some very eminent speakers. One from the industry, Mr. Deepak Pandey, who's the head EHS at Deepak Fertilizer and Petrochemicals. A lot may wonder that why we have industry expert today and why again we have tomorrow. Deepak Fertilizer, ladies and gentlemen, is one of those organizations. They have a group of companies, and in providing that essential commodity for manufacturing sanitizers, they played a very, very important role. And I hope they might just want to touch upon those aspects. Then we have Dr. Anil Kumar Gupta, a dear colleague of Professor Ghosh. He's the professor and head of ECDRM at NIDM, Government of India. He would be talking on perspective of pandemics, role of NIDM in that very interesting presentation, followed by the final presentation by someone I have very deep respect for, Dr. Sunil Pandey, Director, Environment and Waste Management at TERI, State of World Environment and Issues to COVID Outbreak. From an environmental perspective, a very, very interesting presentation which we should expect tomorrow coming from Dr. Sunil Pandey. So we will start again at 2 o'clock sharp tomorrow with a brief background of what we've achieved today, which would be shared by Dr. Ghosh. And I always look forward to revise whatever has happened when I hear his thoughts on each day, because it gets you back into the same mental mode of understanding and of learning. So Dr. Ghosh, tomorrow we'll start with your brief overview of the first day, and we will also check with General Bindal if probably on the third day, when General Bhardwaj will join us during the valedictory, if he could spare some time and we can have his address day after tomorrow during the valedictory along with General Bhardwaj at around the same time, 4:15 or 4:30 on the 11th of June.
Okay. Okay. I think just quickly, I'd say that which mask is best. I think you can ask Dr. Kamal the day after tomorrow. Of course, N95 and many specifications are there. N95 about which I have explained, that is the best so far, which is affordable. But there are 30 rupees, 40 rupees masks are there. They are not of that quality. N95 N95, if you go through the details, you will see that what is the amount of manufacturing and quality, layering, specification, everything is there. So if you are from the scientific as well as from that background, manufacturing and industry specific one, then you can go through the N95, which is around 90 rupees or 100 rupees, something like that. And then another one that you have asked about, what is the third wave coming or not? As I said during my brief presentation also, no one of us, neither me, nor doctor, nor epidemiologist, nor statistician, no one can be assured of that when third wave is going to come. But it is something like that people ask that when next earthquake is due. So nobody can say when earthquake is due. But entire world is under COVID fever. So anytime it may change its way. And so it is very difficult to say that whether it will come or not, if it comes in what form. So there is no definitive answer from anyone, whether it is doctor, whether it is scientist, from anyone. As long as we are taking this breathing this year, tomorrow you will see the interesting session that how climate is getting affected. And how it is becoming climate associated, and so that you will come to know a little bit more detail. More so, some of the typical questions that, like you are saying, N95 sufficient protection for COVID. Again, you see, it is not 100. It is said 95, means 95% of the things that it can. But you can have some, like when it is 100% also, means oil will not come through that. But you see, whatever mask that you wear, whatever mask that available in the market, whether it is N95 or N90, just put a sand, open up the say incense stick or something like that. Do you get that thing? We can smell it, isn't it? So when we can smell a sand or a agarbatti ka jo bhi smell, whatever way of filtration that we are using in the mask. So COVID virus also, they have size, but not 100% they can be protected. But overtly, they have been seen that when these are made following the specification, mask can make a primary protection from the attack of the COVID. But thing is that always we cannot, wherever COVID is there in the air, whichever we are breathing, sometimes mask cannot be kept always like this. So in that case, it get affected. So it is not 100%. That is why people have been trying with many kinds of drugs, many kinds of detection devices where they are concentrated. And because 14 to 16 days of this incubation plus attack and all these things, that period to be maintained, then they die. Generally, within 2-3 days, they die. They become active when they get someone to support, like when they enter into our body, then they get certain kind of energy or protein to survive and act on it, get multiple, then affect us. So all these things you will get an interesting explanation from Dr. Kamath, the doctor. He is from Public Health Sciences. So he will explain you more on this matter. Whatever if I explain that it is not really, or Dr. Ahmed, yes, I think he is a medical doctor. So many of these questions even you can get from the YouTube, or you can get from asking the Google also, you will get something, but always get it verified, checked by the experienced doctor, because it is for them only they would say. We are just only carrying over the things, information that we have remember and tell you. But
Absolutely,
always
absolutely.
advice.
And one very relevant suggestion coming from the medical fraternity: do not self-medicate. Always consult a doctor before you plan to pop a pill. We rest assured that the doctors are well trained and well informed on how to deal with the COVID infection. And it is different for, as Rituraj also mentioned, it is different for every different individual. Nobody understands that better than your own doctor. Always consult a doctor, go for tests which are advised by the doctor, and do not self-medicate. And I think we'll have more discussions in coming 2 days on this subject. These questions coming from Lieutenant Brijesh Kumar, Sneha Katara, Pankaj, all of these, some great comments coming from Sanjay Deshmukh as well. And there's a question from Vani Manchanda. Yes, Vani, you have to use the same login ID every day to sign in, the same email ID. The login link will remain the same. Make sure that you sign in using the same email ID. Very, very important, because your attendance will be tracked at the end of it. And within 7 to 10 days of this OTP ending, so let's say around 20th, is when the certificates based on the attendance would be uploaded on the NIDM website, which can be downloaded. The certificates are jointly issued by FICCI CIDM board and NIDM. So, but yes, please make sure that you use the same email ID while you log in, so that it makes it easier for us to track your attendance. We start at 2 o'clock sharp again tomorrow. So I think on that note, Dr. Ghosh,
we want to remind them that getting e-certificate has been automatized at NIDM server level. But in order to get e-certificate, each of our, what we are speaking or talking or everything is getting recorded. Similarly, your presence and all time is being noted by the computer automatically. But in order to qualify for e-certificate, we will check that whether you have minimum attendance of 80% or above in all the 3 days from 2 to 4:30 or 5 o'clock. This is one aspect. Second aspect, this time on the last day, we'll see that there is some trivial rather I would say feedback form is given from an IDM side, which is only 3-4 questions. But in order to see that, since we are not able to see you, interact with you directly in this platform, so we will send you a feedback form which will be more elaborate, mentioning about each and every lecture, and you have to give your opinion on each of every lecture, not only about how good is the lecture or how bad is the lecture. There I'll make a Google form and send it to you, all the 7-8 lecturers' name, and then grading that you are going to make for what is the quality, which will be coming to us for our own record and report. At the same time, those who are now, I see that more than 234 of you are there. We would also like to see that from each of the presentation, we will put in the question in such a way that like in my presentation, there are 34 slides are there. So I'll be giving some sample such Google forms. Say in the 22nd slide, I will mention the topic, and then you will see that in the 22nd slide, of course, number is not there. When I see the topic, then in the Google form, we would like to have your view, whether you are going through or not, because we know that it is not always possible. It is beyond any patience limit to keep on gluing to what each and every lecture after every half an hour they are saying. It is not possible. But in your leisure time, like now it is going to be over, but we would like to check that since all the lectures are there in the Google YouTube, which you can again go through, then we would like to see that in the feedback form, we want your authenticity giving a feedback on your listening to that and understanding. So we'll put some suitable query to you, which you can easily answer, but we want that you can check your authenticity as well as your presence effectively. That also you will judge, you will give a judgment on yourself. So that, the word training, which is literally used over here, so then if we can be able to justify ourselves, yes, it is something that we want from your side, what we are delivering over here, what we are discussing over here, it is going to you. Of course, here the permanent record is there, but we want certain kind of feedback form in this format also on the last day, and it will be given to you to your all registered email, and based on your feedback, then your e-certificate, because certificate, with NIDM, FICCI, Government of India logo will be there, but it is only participation certificate. But we would ourselves want to justify that certificates will be given to all of you who are really, with us, and you have been encouraging us.
Thank you. Thank you, Dr. Ghosh. And thank you, Wasim Raja, Sonia Rajoria. I'm afraid I can't take all the names, but Rajpal Singh, Priya Bhatt, there are so many names, who really sending their feedback, positive feedback. Swan Saraf, Priya Bhatt Sharma, Happy Singh Sethi, all of these, and of course some of the regular members of our training program, Professor Dr. Ilakuvan, Girdhari Dalji, Rashipal, all of these names. Thank you so much for sharing your feedback live with us on the quality of the session, of the presentation. Thank you so much. So until tomorrow, I would now I think we'll close the session for the day. Until tomorrow, when we meet at 2 o'clock for the second day of this 3-day OTP. Have a very good remaining of the evening. Have a good night. See you tomorrow. Take care of yourself. Follow the COVID appropriate behavior and stay safe. Thank you so much, ladies and gentlemen. See you tomorrow. Thank you.